Hey there, guys. I am so excited to be having this conversation. I have Katrina Fury with me. Dr. Katrina Fury is an MD. She specializes in women's mental health and reproductive health, right?
Yep, reproductive
Okay.
psychiatry. Yeah.
Okay.
All about the
And
hormones.
and today we are actually going to have a conversation about postpartum psychosis, which I've had a lot of people ask me about on my page. I obviously can't speak to this very well, so I thought it would be really awesome to have you on. And this was something that you reached out because you were very passionate about the topic.
Mhm.
And so before we get started, I just want to let everyone know that you guys can follow Katrina on Instagram and Facebook at Dr. Katrina Fury. And I'll give you just a minute if you want to introduce yourself to the audience and let everyone know who you are and why you were passionate about this topic.
Sure. Thanks, Kody. It's so nice to finally meet you virtually. So I am a psychiatrist. I went to medical school and then did my psychiatry training at Yale, where you might be surprised to learn that in psychiatry training, you're not actually required to teach anyone about women's mental health and the hormonal fluctuations and how that affects women's mental health, which I think is pretty shocking, but maybe in line with the patriarchy. Um, and so I just saw that, wow, it turns out like pregnancy is like a really stressful time, even under the best of circumstances. And then it's a really vulnerable time for women when it comes to their mental health. And so as I've graduated and opened up my own practice and gotten more into this work, it's just such a rich time to work with women. Um, in terms of psychologically, they're going through a lot of change, and in terms of their identity shifting. And then biologically, it's a time when women are at really high risk for things like perinatal depression, anxiety, OCD, and then psychosis. And postpartum psychosis, even though it's the most rare postpartum mental health condition, affecting like we think 1 to 3 women out of 1,000 births, compared to something like postpartum depression affects 1 in 7. So it's more rare, but the rates of suicide are so high. The rates of harming your children or taking their lives are so devastatingly high. It's incredibly scary, and often it comes out of nowhere. So it's a very scary condition that I think the medical field is still trying to better understand. We think of it as being most of the time part of the bipolar spectrum of illness. So usually it's more in line with that. However, 20 to 50% of cases are only occur in the postpartum period and then they resolve. So while the majority of patients go on to develop a bipolar disorder, which includes depression, mania, hypomania, there is a percentage who don't. And again, even that's like, why? So we still have a long way to go in terms of understanding the biology, but I think that it's such an important condition to talk about. It's something that we don't talk about. We don't educate women on what are the early signs, and I think that's why people just don't know about this. And so I really appreciate being able to talk to your audience about it to raise awareness.
Could you tell us a little bit more about like what is postpartum psychosis? How does it
Mhm.
relate to psychosis as a symptom? Because
Mhm.
I've talked about psychosis in the fact that when I started making content, a lot of people that I talked to assumed that psychosis was only to schizophrenia. It was like
Mm.
exclusive to this
Mm.
diagnosis.
Mhm. Mhm.
And so, can you explain more about like what I guess psychosis is, but also
Mhm.
how it relates to postpartum psychosis?
Sure, that's a great question. So I would say that psychosis is a symptom. It's you can use it inappropriately as like a diagnosis, but it's not, right? We can see people with depression can have psychotic features. You can have schizoaffective disorder. You can have schizophrenia. You can have psychosis from using too much cocaine. You could have psychosis from steroids that you're getting because you have cancer and you have to be on steroids. So psychosis is a symptom, and we usually think about um, positive symptoms like hallucinations. Most of the time, those are going to be things like visual hallucinations or auditory, right? Like you might be seeing unusual things or hearing unusual things, whether it's, and I'm sure you can speak to this more than I can, whispers or frank voices or things like that. A lot of times, those can be, they can be telling someone to do things, And that can be very scary and something we see in postpartum psychosis. And that's when you want to keep in mind that besides the sort of hallucination experiences, you could also have delusional thoughts. And what is that, right? That's like a confusing word. The best way to think about it is delusional thoughts are bizarre thoughts that aren't in line with the culture, the community that you're in, right? So some cultures, specifically like in Haiti, for example, after someone dies, they still in their culture believe that you might like get messages from them or see them out and about and things like that. We wouldn't call that psychosis because that is normal in their culture, right? That's shared by their community, their family members. Delusional beliefs aren't, unless you have like a folie à deux or some sort of like cult mind thinking or something, you know. But delusional beliefs are usually paranoid, where you're scared or you feel like someone's out to get you or someone's following you. They can be grandiose, where you think you have special powers or you're getting special messages. And they can be bizarre, where they just don't quite make sense. You know, like the aliens are talking to you or the TV is talking to you or things like that. People with psychosis also will often have disorganization in their thoughts. So their thoughts might be coming very fast or very slow. If you're talking to them, it might be hard to follow their train of thought. It might be hard for them to put their thoughts together. It might not quite be making sense to them. And then in the most severe cases, you might see things like thought blocking, where all of a sudden the thought just goes away, doesn't come back. You might see abnormalities in their speech, things like we call clanging, where they will say a word like, trying to think of an example, like cup, duck, pup, like, you know, things that like sort of sound similar but don't make sense when you put it together. So those are some of the hallmark symptoms of psychosis. And again, you see this with schizophrenia. Also with schizophrenia, you see the negative symptoms, which you may or may not have in the postpartum period. But you can have psychosis with other conditions.
Like I said, I've talked about psychosis a lot on my channel. But I've also mentioned to people that the most common age for women to be diagnosed with schizophrenia is 21 to 31, which falls right into that age range of
exactly.
you know, when women are having their first kids
Exactly.
or having kids. So how does that factor into like a diagnosis of postpartum psychosis? Because couldn't it be confused for schizophrenia, or does it look for
sure.
more long-term symptoms? How does that go about?
Yeah, for sure. So with postpartum psychosis, what we mean by that, and again, like if you look at the DSM, right, like the Diagnosis Bible, there's not a section on postpartum psychosis, right?
So
like
it's not actually like a diagnosis.
Right. So there's not always clear, here's the criteria. You might have like psychosis with postpartum onset or postpartum depression with psychotic features. But when we say postpartum psychosis, what we mean is a change in behavior, activity, thought pattern, and psychotic symptoms, the positive symptoms like hallucinations, delusional beliefs. And it's the delusional beliefs that are the scary part, because what happens is most of the time those beliefs are focused on the pregnancy or the baby, and they have an altruistic nature where the mom thinks she has to hurt herself, hurt the baby for some delusional reason, like the baby's possessed by the devil or the world will end if they don't, like something like that. Like that's an example of a delusional thought where it's not connected to reality, right? Whereas like people with anxiety also might have a lot of thoughts that maybe like don't make sense, but they're connected to reality. They're like afraid to get in a car accident or, you know, like something like that. So that's what we mean by postpartum psychosis. And it, most of the time, again, it's indicative of an underlying mania or bipolar disorder. And the reason we know that is that the vast majority of women go on to develop that. A lot of times this could be their first episode of a mood or psychotic disorder, which is terrifying. I mean, it's terrifying anytime you experience your first episode, but especially in that period when you're so vulnerable. And then if you like, as people have traced it out, people, you know, go on to have more episodes later on, whether depression or hypomania or mania. But there is that 20 to 50% subset who don't. And I think that will be really interesting, over the course of my career, over the next 30 to 40 years, to see like, what's the difference? Like, I wouldn't be surprised if there is something about the hormonal shifts, because we also know, you're exactly right, that women are most likely to be diagnosed with schizophrenia during that time frame, and it's a little later than men. And we also know that only women have a second peak in perimenopause when their estrogen's going down, men don't. And that in the perimenopause time, the rates switch. So like until then, more men live with schizophrenia than women. After perimenopause, it's more women than men. And so I'm fascinated by this research. And I think there's a lot more of it that we need to do, but it seems like estrogen itself has some protective effects. So we think that when you deliver the baby, you have a huge plummet in your estrogen levels. And we think that's the catalyst, and why most cases of postpartum psychosis present very early on in the postpartum period, usually within 48 hours to 3 weeks. And then it's like, then the next most number of cases is in the next 1 to 3 months. And then it goes down in terms of the farther out you get. But we still see cases develop, like if a woman is nursing and then she weans. So there's something to those hormonal shifts. And then, another very big early sign to watch out for is if you're not sleeping. And we know that's another trigger for mania. So that's where they're connected. But if a woman, especially early on, isn't sleeping, but she's not tired, that is very concerning.
From what I hear from my brother with 2 kids under 3 is unfortunately very common with
Right.
newborns.
Right.
So like,
Exactly.
and we know based on like general science that not sleeping can take a neurotypical person with no mental health issues and cause a lot of issues. So
100%.
I've talked about this where when I was before I was diagnosed, I was also trying to use drugs as a way to cope with what I was going through. And I was afraid of one of my delusions or paranoid thoughts was I was afraid of being sedated, in the fear that they would like bring me into a psychiatric facility or something. So I would try to stay up days at a time.
Yeah.
And that can do such horrible things to someone who might already be struggling with an underlying symptom like psychosis.
100%. And that's exactly right. And we know that sometimes it is the change in circadian rhythm that can bring out a manic episode. Like I've had patients who had their first manic episode after a transatlantic flight. We see that in the newborn period when you're not getting enough sleep. It's why we like prescribe sleep to women with bipolar disorder or past history of postpartum psychosis. I will literally give them a birth plan and a sign to put on their hospital door that says like, you cannot interrupt me overnight. Like I have to sleep. And so what I do as someone who's sort of trying to figure out what's going on is, if you're not sleeping because of the newborn, but then your baby finally falls asleep and you can finally sleep and you do, great. That's different. Like if you're feeling tired during the day, but once you can fall asleep, you're able to, great. If you're not sleeping because you're up writing your autobiography, or you're up vacuuming, like, incessantly, or you're up gambling or whatever, you're up because you're very active and you're not tired, that's when I worry about like a mania or a psychosis.
What advice would you have for doctors, nurses, nurse practitioners who are dealing with women who are or if they're in like if they're in an area where they are dealing with women who have recently given birth, stuff like that, and what signs can they look out for? What should they be concerned about? What are the first things that we see with postpartum psychosis that are a concern?
That's a great question. So I think, first of all, we just have to keep talking about it and let women know that this could happen, but also reassure them that compared to the other postpartum mental health stuff, it's more rare. Your risk goes up. If you have a history of bipolar disorder already, you're at highest risk for postpartum psychosis. That's why it's really important to talk to your patients about continuing on their medications or making an adjustment if they need to be on a medicine that's safer for pregnancy. But it's really important to have those discussions even before they might be thinking about getting pregnant, because most pregnancies are unintentional. It just, that's the reality. So like we really need to just start talking about this way earlier. And then again, the decreased need for sleep is a huge sign. If they are talking differently, either quicker or kind of all over the place. It's hard to follow their train of thought. If their activity level is really high, if they're experiencing a fluctuating level of consciousness, like a delirium picture, where maybe in the morning they seem fine, like their usual self, but then by the afternoon, all of a sudden they're talking about a lot of religious content that's not normal for them. But then by the evening, they're okay again. I would be very concerned about that. I think some people get like accidentally reassured, like, oh, they're better now by night.
Yeah.
No. That's a very big warning sign. Most cases occur with some depressive symptoms. So not everyone is going to be the manic patient who won't sit still. So you have to keep that in mind. And you have to ask the patient and also whoever is around them about their behavior, because they might not have the awareness or the insight that what they're thinking is unusual for them. It might be the people around them who are really clued in. They might have that awareness and be very scared to tell you about it because they're afraid you're going to call Child Protective Services or send them to the hospital or take their baby away or think they're a bad parent. It's very tricky to talk about this stuff. I think again, we need so much more research to better understand this condition. I find talking to people who have lived experience, that is the best way for people like me to understand what to look for. I've actually learned the most, I think, by talking to survivors of postpartum psychosis. So Postpartum Support International is a wonderful organization. Cherished Mom is another organization that does a lot of work specifically for survivors of PPP. There's a lot of support groups. There's a lot of people who write, novels about their own experience. I think that's where we can learn from it, because something I've learned is that we were always taught that if you have intrusive thoughts about harm coming to your baby and you're scared of it, it's probably not psychosis. It's probably anxiety or OCD, but it turns out it's not that cut and dry. And a lot of the women I talk to who have lived through it will say there's a brief period of time where they notice something's wrong. They're not thinking right. They reach out for help and they're told, oh, it's okay. You're tired. You have a newborn. You're stressed out. And no one gives them the right treatment. And it gets worse very fast. So, I mean, within 24 hours, someone can go from having delusional, bizarre, confusing thoughts, being scared of them, to them believing them and acting on them. So that is the part that's really scary. And I think we have to intervene. And I think that involves providers like me having a way better understanding of what to look for and believing your patient. If they come to you and, believe them.
Yeah. And you mentioned early intervention, which for any mental illness or symptoms of a mental illness is so crucial. I cannot obviously mention the amount of other patients that I get to meet when I travel and do speaking events who tell me, kind of similar to what you just said, people with schizophrenia can sometimes see some of those symptoms when they first start. But just like you mentioned, once those symptoms get started, it becomes your way of thinking. You can't correct it. No one around you is going to be able to convince you that it's wrong or incorrect. So getting someone the help they need early on is always going to be so crucial. And I've learned a lot during this conversation, but before I let you say any final words or talk about any groups or anything like that, do you have any advice that you would give to patients or their families if they have been recently experiencing psychosis, or they think they are, or the family is worried in any way? What are the best steps to get their physician or doctor to listen and understand the severity of it?
I think just to keep emphasizing it's not your fault, that you haven't done anything to bring this on. It is very biologically driven, and that's why we do have treatment that works. If you are worried about someone, please do whatever you can to bring them to the emergency room. Again, because the symptoms can progress so quickly. Again, most of the time, it's not going to be PPP. It's going to be depression or something else, or anxiety. But if you are worried, if your spidey senses are going up, you got to listen to it. And we also, in the setting of postpartum, want to rule out any potential medical causes. Yep. Any thyroid imbalances, retained placenta tissue, any neurological stuff. Did you have a stroke? Are you having a seizure? Stuff like that. In my experience, for the patients who had insight and have now lost it and think, I feel great, I'm on top of the world. But you're like, oh, no, 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 no. Sometimes, and again, is this a little, I hope this isn't manipulative. I don't think it is because I'm, working in their best interest, but sometimes telling them we really need to get you to the ER to make sure you're okay medically because we're seeing a change that isn't your normal self that you're not appreciating. I get it. You feel great, great, but we got to make sure that medically you're okay. Sometimes that can help if they don't have that insight that something psychiatrically is wrong. And it's not a lie because we always work that stuff up and make sure there isn't a medical issue. But as a loved one, that can be something you can say to try to get them to help. And I would say trust your gut. Just trust your gut. And if your provider isn't listening to you or you feel like they're not taking you seriously, Postpartum Support International has a provider hotline and a patient hotline. There's the National Maternal Mental Health Hotline. There's 988. There's a lot of resources out there. There are psychiatric access mental health programs. I help staff the one in Connecticut, but specifically meant for the perinatal population. You can go on the Postpartum Support International website and find your state's hotline. So there's a lot of stuff out there if you know where to look. It's hard to know where to look when you are really worried about someone you love, right?
Yeah.
So those are sort of the things I would say.
Awesome. Well, I appreciate you coming on and having this conversation with me. One more time, if you guys want to follow Katrina, you can follow Dr. Katrina Fury on social media. And do you have anything else that you wanted to mention, resources, anything like that for people who might want to learn more about postpartum psychosis?
Sure. I think so. I'm new to Instagram and stuff, but I'm trying to use it to spread accurate information about this stuff. I've gotten so frustrated with all my patients coming in, thinking all this stuff that I'm just like, no, it's not right. Like, let's get the real info out there, Similarly, I think that there's other people with lived experience who are talking about their experience. I want to plug my friend Aisha's book that just came out. It's called A Mom Like That, a memoir of postpartum psychosis. She is also on social media. I think those stories are really important. And then I'm also in the process of releasing my first series of courses for medical professionals called Repro Psych Academy, where I will help teach you how to better understand how to pick up these conditions and then what to do. So it's really geared toward like OBGYNs, therapists, APRNs, general psychiatrists who maybe don't feel as comfortable. I want to help you feel comfortable so we can improve the rate of treatment that women can get. And then in the near future, I hope to have an arm just for the average person who wants to better understand like what's going on when I get my period. Why do I feel like this? Because like there's science behind it and no one tells us for some reason. So yeah. I'm trying to, help with that.
Awesome. Well, thank you so much for this conversation. I really appreciate it. And if you guys want to check out any of Katrina's social media, I will have the links in the description to this video. Also, if you have any questions, list them down in the comments. And if we get another opportunity, I might have Katrina on for a follow-up and ask some of those questions from the audience. So thank you guys so much.
Awesome.
And thank you so much for coming on.
Thank you.
And I'm excited for my audience to see this and learn a little bit more about postpartum psychosis.
Yes. Thank you so much, Kody, for highlighting this. I really appreciate it.
Absolutely. Have a good one.